Hello, everyone, and welcome back to the Flint Community Webinar, your community resource. I'm so excited because we have a great group of panelists today, a great group of expertise. We just got done hanging out and talking, and they're going to bring you some wonderful expertise. This month, we are dedicated to thinking about our seniors. So we have brought the wonderful Dr. G and Nurse T here, and they're at a senior center, and they're going to give us a couple Q&A questions. We've got Kathy Metz, who's here from Hurley and who's going to talk to us a little bit about the senior services over there. We brought back Nicole Smith Anderson from the Greater Flint Health Coalition, who's going to give us some wonderful resources. Dr. Kent Key, who's going to talk to us a little bit about a family health history and why that's particularly important for our seniors. And then we've got Brianna Carpenter from the Valley Area Agency on Aging, who's going to talk to us a little bit about the resources and services that they have. So we're going to get right into it. Thank you so much to all of our panelists for being here and all of our experts. I think we're going to start a little bit with Kathy Metz and understand what services Hurley has to provide our seniors and what our seniors should be reaching out to Hurley for.
Thank you so much. I'm excited to be here. There's so much good energy in the room, and seniors are my passion. It's a blessing that I was given this service line to grow and be over for the last 10 years now. So I like the tagline that Hurley is truly the safest place for seniors. There's many reasons, and we'll talk about those. Just a little bit, about me, as I'm almost going to need all my services I've put in place because I've been at Hurley for 40 years. That passion and energy I have for my hospital and this community is so strong, but I also love that we're putting a greater emphasis on the resources that we have for senior. We've been very well known as a children's hospital and places for babies, but we're really growing in programming for seniors, and that just makes my heart so happy because that's the fastest growing population in Genesee County right now. So if who's ever being so gracious to advance my slides, if you would, I will talk about where a lot of the care begins, which is in our emergency room. And for about 10 years now, we have had a practice, and it's unique to Hurley in this community, where patients 65 and older are triaged immediately. That doesn't mean, because sometimes people get confused, like, oh, that means you go right up to a room or you go, whisk right out of the emergency room. It just means that when a 35-year-old walks in with a cold or even pain from a fall, it's a whole lot different when someone 65 and older comes in with colds and flu symptoms or pain from a fall or any one of those things that might happen to both age groups. We just know that things escalate, can be more serious, and can be more of a crisis for someone older. So we get our patients that are 65 back to be triaged, and that means we check you out and a nurse assesses you. Now, obviously, if it's something simple, it may not then proceed with a lot of escalation. But if that nurse and that assessment detects, boy, when you fell and you seem a little dizzy, we better get that CAT scan right away. We're going to do that for our seniors a lot faster. So while there still may be some wait time for tests and providers, you're under much closer supervision and things move at a more rapid pace in terms of figuring out the diagnosis or the best treatments for you there. So we're very, very, very proud of that. We won a level 1 it's a geriatric accreditation for emergency rooms. And we've had that in place now for 3 years. And one of the requirements of that is that we continue this process and demonstrate our consistency with this process. So right off the bat, when you come, we want to make it known that you are a priority, that seniors are a priority. Next slide, please. Then we have a geriatric fracture center, and it's not a physical space or a part of our building. It's a virtual center. It's an approach, very systematic approach to care for geriatric patients that have sustained a fracture that brought them to Hurley. So it's a bunch of different order sets that when you come in, be it a shoulder, be it an ankle, immediately once that's identified in the triage process, a button is pushed, and then all of the things that are needed to get the best diagnosis for that and treatment for that are sent out at one time. So every consultant, every lab, every x-ray, every CAT scan, they're all in these order sets. So we treat them very standard. Because we're a level 1 trauma center, we follow protocols that allow us to keep that accreditation. So it's very quick and rapid, and it's happening without patients really knowing it. So that's why it's still a geriatric fracture center, but it's a virtual approach. Most importantly, and the thing that I don't think people think about until it happens to them or a senior loved one, is a hip fracture. Hip fractures actually are trauma, a very serious trauma for seniors, and really need to be taken care of at a level 1 emergency trauma center, where we are required to have an orthopedic traumatologist. Other hospitals have a lot of orthopedic surgeons, but we have to have one that's fellowship trained in trauma. And the reason that's so important is that the survival rate a year later for patients that suffered a hip fracture, it's not great. But the research shows that if we can get the patient in, get all the treatment going, and get them into surgery in 36 hours, their survival rate a year later is increased tenfold. So we have a very, very, very efficient process with anesthesia. We have a clock in our electronic medical record. That's the computer we use to take care or document our care. It has a timer in it for the diagnosis of hip fracture. So the entire hospital and the OR is watching that. And then, if it's because there's not availability, we'll bump cases just so we can meet that, because that helps us retain our level 1 status in the state, but it's also what's best for seniors. So people sometimes aren't aware of how serious and really where they should go for the best care for a hip fracture. And I would absolutely say that's Hurley. Next slide, please.
Hey, can I ask you, what does it mean to be a level 1 trauma center? Why is that important? And are there other level 1 trauma centers nearby, or are we the only one located?
There are. So it's actually dictated by the state. Like, you can't just tomorrow, McLaren couldn't just become a level 1 trauma center as well, because a lot of resources are needed to hold that status, but it identifies the level of emergencies that you can take care of. So the most serious emergencies are considered to be level 1. So Beaumont and Ann Arbor, but they set it up so that everyone, almost like a area agency on aging, where you want to make sure that there's geographical ability for someone, either helicopter or by ambulance transport, to get there in a reasonable amount of time to save their life. So we have had that status. We could give that up, and then someone else could apply for that and do the things that they need to do. But again, there's a lot of things. There's a lot of data. You get surveyed every year to make sure you're meeting all the metrics for everything, not just orthopedics, but time to wound, time to, I guess I could probably give you some more detail, but basically there's a lot of little standards you have to meet to be that level 1 center. So was that helpful? Or
That's super helpful, and that makes a ton of sense. So it seems in Flint, Hurley is the level 1 trauma center geographically. Is that correct?
Correct. Yep.
All right.
And for quite a big area, Genesee County, and
Yeah,
we have helicopters. So there are places up north, and the thumb area is kind of void of that. So we're often a center for a lot of the thumb area traumas that happen, car accidents, severe car accidents, gunshot wounds, tractor injuries, those kinds of life or death emergencies are what go to a level 1.
got it. And there was one other question in the chat about, you mentioned particularly, for example, hip fractures, but for our seniors who need to get in quickly, there's a lot of resources that we're mobilizing quickly. And we had a question about IV fluids and whether that's a limiting resource, or is that something that, particularly at Hurley for seniors, that there's access to. The specific question says, Has the shortage of IV fluids had any effect on surgeries?
Thank goodness, no. I know there's a lot that came out of North Carolina that people have heard about in the news, and thankfully there some of those major companies that exist in North Carolina have places on, more central in the United States, and we've been able to, our supply chain has not been disrupted yet. So we're lucky, and I think it's returning to normal for most everyone. But great question, because that is always our immediate concern, especially during COVID when supply chain was so disrupted. We were robbing Peter to pay Paul and driving to Covenant to grab some of their things and sharing, what we had with others. So it was a terrible storm, but we are in good shape for supplies.
Thank you so much, Kathy.
Yes. The next thing I'm super excited about, it's a grant funded program. I actually saw it in Cleveland. It's the ambulation team one. Yep. And I'm not sure, maybe just my Google slides didn't translate as well, but it's the ambulation team, and we call them the A team. If you're old like me and you remember that great show, the A team, but it's very catchy and they wear shirts. But when my husband had to be in Cleveland clinic, I saw this program where they had these people that were just very casually dressed that came around and walked patients, and they were not clinical. They were just taught how to mobilize patients that are safe to mobilize, and it relieved the pressures of nursing and physical therapy. And I thought, what a great idea. So I looked up the paper, their research paper, and this community is so generous. We were able to get a grant to kick it off. And it's for patients that are 65 and older. There's 3 members of the A team. They were taught how to ambulate safely, but we put patients on a list that don't have any specialty needs for walking, because I'm also a physical therapist, and there's only a few of those, and that's for skilled ambulation. That's a pretty highly expensive resource to send onto the floor just to do some ambulation. And then nursing is supposed to be doing that kind of ambulation, but we all know how nursing shortages, staffing shortages, nursing, the volume of things they have to document anymore. So it was just a way to decompress both of those services and direct those to the patients that needed the care that they were special in, and get somebody almost like a companion or someone to just keep people moving. And we know literature is very strong in saying movement is medicine. You don't lay around in your bed all day. That is not how you get better. The olden days, just lay in bed and rest was the hospital, and people would stay for weeks for knee replacements and things. That's where bad things happen, when you don't move. And one of the biggest things that happens is that people get hospital delirium. People otherwise normally healthy, cognitively intact people would be in the hospital and suddenly get a little confused because there's bells and buzzers and whistles and lights on at night. And so just that exercise during the day gets them that rest at night that they need. It helps them make sure that they don't decline while they're in the hospital, so that they can return to the place they came from. I'm sure Brianna will talk about, that's the area agency on aging. We want to keep people aging in their homes. So if you come here for something simple and we let you get weak and delirious, now you need to go to a nursing home, that's not a good thing. So we make sure those patients that can safely walk with someone that is only mildly trained, we make sure we walk them twice a day, and we get them up in a chair twice a day if they're not quite walking with safety. So we really have seen such success. They're fun, they're company, the elderly people just love them to pieces. They're not there to give them a shot or a medicine. They're just there to walk with them. So we love that A team, and we are pleased to be able to provide it through 3 years now, and we're going to keep doing it even if the grant money runs out. So
Kathy, I just wanted to mention how important this is, because in the hospital, right, you mentioned this, physical therapy is a really skilled resource, and the idea that you're getting people up who will engage with you, but also just get you moving, right? We know, especially our post-surgical patients, part of the way we get people out of the hospital, just like you said, is that we get them moving. So this is such an excellent resource. I really, I'm just really floored. This is outstanding.
Yeah, it gives me goosies. And I mean, I stole it from Cleveland, but I don't, I'm happy. It's fine. It
Well,
was a
now
good
we have it
idea.
in Michigan in Flint at Hurley. So now it's
Yeah. And that's what I love about my hospital too. We often don't put margin. We put mission over margin a lot. So I'm blessed to work at a hospital that says, all right, might cost us a few nickels here and there to or whatever, but it seems like the right thing to do. So
absolutely.
next slide, please. This is another beautiful program. It's called the Hospital Elder Life Program, or HELP is the acronym. It is done at several hospitals in the state, but it's just a phenomenal, phenomenal program. Again, it's a volunteer-based program. We have an employee that runs it, but it's staffed by volunteers, and they go sit with patients, talk with patients, play games with patients, read the newspaper with patients, help them make calls to their loved ones, because I'm still working, and until recently I had both parents alive, and when they were hospitalized, it was like I just couldn't get there, nor could my sister who lived. So sometimes seniors are in the hospital by themselves, and again, without walking or moving or engaging, they get confused and delirious, and they get sad and depressed, and all of those mental and cognitive things are just as important as the medicine we're giving them to fix their heart or their infection or whatever. So we next slide, please. I think we'll talk about some of the things in this next slide of the people do. So it's a daily visitor program. We train these volunteers, and we were just so blessed recently that the U of M Flint PA students are now making this part of their program, so they all have to participate, which is awesome. But then we get volunteers from all different areas. They visit again. They they ask the patients, like, what do you like to do? And we have this giant office filled with beautiful donations. Maybe they like a crossword. Maybe they like to play bingo. Maybe they like to hold a real newspaper. Maybe they forgot their glasses or their hearing aids. We've got those too. So we go down to the office, pack a bag of the things that Mrs. Jones likes to do, and then the volunteer will go back up there. Or maybe they just get a tray and their arthritis is such they can't cut their food. Nurses don't always have time for that. So the hospital elder life program volunteer will cut their food up and talk to them while they eat, pour their milk out of the container. And then sometimes people just want to feel that sense of touch, or hear music. So we have a lot of really great different relaxation tapes. They've been trained to do like maybe hand massage. It's a really great program, and the supplies that we have are kind of endless. Just that nice touch service.
That's awesome.
Yeah, it's pretty cool. And next slide is our Safe Step program. I'm going to pretend there's a slide that came before this. I forgot to tell you, we also have a grant-funded person, a cosmetologist, who does bedside hair shampooing, or she'll cut your toenails or do your nails as well. And we are so grateful for that grant every year. And she's just an awesome person who touches our seniors in just perfect ways. Safe Steps program is an outpatient program. So anybody who comes to Hurley with their primary diagnosis being a fall, it flags you, and you get an automatic referral to Safe Steps if they want to. You don't have to go, but we have specialty trained physical therapists. They've actually gone through a program and tested for this program, and then we have them at all three of our locations in physical therapy. So if they want to work on core and the balance program from the Safe Steps program, and then we walk through their home. We don't go to their home, but they either take pictures of their home. We talk about how to safe-proof their home a little better, and it's a 4-week program that can be extended to 6, and we're really just trying to prevent further falls, and educate about the prevention of falls with this. So we're really excited that we've got so many therapists through the training and available to help. And I believe that is the last slide. Yes. And
awesome. The safe steps is really cool because especially we know that falls are the biggest, right? That's how our seniors get hip fractures and then, need to activate some of the services that you've described. So wanted to say thank you. This is amazing. I guess if I had one other question, you mentioned a couple grant funded programs. Who applies for these? Like, how do you, what are the resources you have to apply and make sure that you keep these grants sustained?
Well, it's sort of a team effort. I mean, I'm just always looking online, writing and reaching out, for I'm constantly writing people to see what they might be interested in doing, be it for the food pharmacy or my psych units, but once we find something, or our foundation office often is given opportunities, so then they'll send it to me and say, hey, what do you think you could use? They're looking to do something in the area of this. Which one of your programs do you think might fit that?
Yeah.
So I'm not a grant writer, but I can write with passion. And then I have this beautiful lady in the foundation who turns it into magic. And then we pray and cross our fingers and we are blessed.
I want to shout out Nurse T, who was the one who made sure we were connected with you and all your wonderful resources. And a shout out to you. I had an inkling that you were probably the one looking around, finding some of these opportunities for our community. And I wanted to give you an opportunity to get that shout out to you. Super thanks to you for all of your resources. Nurse T, do you want to say anything really quick?
I just want to say that the presentation was awesome. The seniors really thought the information was beneficial. One thing we highlighted is that, what did we highlight? Movement is medicine. That movement is medicine. And so we looked at it too from the perspective of when there are patients in the hospital, and like when the staff come and don't be so quick to say, I don't want to get up. Yes. Just letting them know ahead of time that the expectation is that movement is medicine, and that when they are in a hospital, they need to participate in their care. We did ask them, what would they like to see, or what would they like implemented as far as them to feel comfortable. And they said some of the concerns that prevent them from walking is if they feel dizzy. If they're afraid that their legs are going to give out. But because of the consideration and the time that's put into this, they said they really appreciate it and will try to do their part.
Oh,
shout out
awesome. And you know what? And sorry to interrupt, but that is a concern. And even if that's your concern, sitting up in the chair as long as you can during the day when you're hospitalized is so much better than just laying there, and it will absolutely help with some of the dizziness. So that helps combat that, because dizziness often comes when blood is pooling while you're laying down, and then you get up and then it all rushes away from your head. So just challenging your blood to continuously work upwards happens better in a chair. So maybe the first day you're in a chair and that kind of movement, and the next day you feel like you can walk.
Anybody else have a question?
Thank you so much to Kathy. Shout out to your seniors out there, Nurse T, that we're going to be bringing them back shortly. If you ever have questions, always ask your nurse or whoever whether you should be getting up. If you're feeling dizzy, we don't want you moving too quickly. Just make sure you're asking if you can get some assistance. But that was wonderful. We're going to pivot a little bit, right? We've talked about all the resources we can have if our seniors are in hospitalized settings. We're going to talk with Brianna, who's going to talk to us a little bit about the services that VAA offers. So thank you so much, Brianna, for being here.
Thank you so much for inviting me along to be a panelist. I really appreciate the opportunity. And thank you to everyone who's attending and getting some great information about senior resources and how to promote healthy aging. I also want to just shout out to our community partners. Really, you help make our services run smoothly by sending us referrals and getting the seniors the help they need. So thank you to our community partners, Greater Flint Health Coalition, Hurley Medical Center. Not only does Kathy Metz sit on our VAAA board of directors, but we do have a partnership with Hurley Hospital where we have staff that go into the hospital and see senior patients at bedside. That really kind of helps streamline that process to get those services when they're returning back to their homes. So thank you, community partners, for all the great work you do. So just a little bit about myself. My name is Brianna Carpenter. I'm a master level social worker in the Information and Assistance Department at Valley Area Agency on Aging. I started with Valley in 2016, and I've had a variety of different experiences since I started at Valley, from community outreach to doing in-home screenings, telephonic screenings, and I also helped pilot that hospital referral program as well and had kind of a hands-on role when that first got started. So I do have a lot of knowledge about our programs, the eligibility requirements, and community resources that are available outside of our agency. So I do have a PowerPoint that I'd like to share as I kind of go over our programs. And, you know, we do have several different programs at Valley Area Agency on Aging. So as I kind of go over the eligibility requirements, the one thing I really want to hit home is that, you know, we're all things senior. We're a one-stop shop to senior resources. So if you're not sure of which program the senior you're helping, or, you know, if you're a senior yourself that you may qualify for, just please reach out to us, send us a referral. And our information and assistance department, we're the front line to the agency. So we will get information about your needs and help find the right programs and resources for you. So a little bit about Valley Area Agency on Aging. This is our mission statement. We provide action, answers, and advocacy for the elderly and disabled adults of Genesee, Lapeer, and Shiawassee counties by enhancing lives, promoting choice, sustaining independence, supporting caregivers and their families. And we are all things senior. That's our tagline. No matter what services you're looking for, we will try to find a solution to best meet your needs. So what does VAAA offer? So we have many different programs at our agency. Our ultimate goal is to help seniors and individuals with disabilities to stay in their home as long as possible and age in place and avoid nursing home placement. So ultimately, the way that the process goes with Valley Area Agency on Aging, like I mentioned, any incoming call or referral, we'll first go through our intake department, where an information and assistance specialist will provide a telephonic intake and screening to determine what services the senior or individual may qualify for. We offer a variety of different programs, from long-term care in the community to home-delivered meals. We also offer a few telephonic programs and a variety of health and wellness programs too. So I'm going to dive in a little bit into each of our programs. I do have our eligibility requirements listed on each slide, and I also have a helpful chart of our programs that I'll share in the chat at the end of my presentation that kind of gives a quick glance at all the eligibility requirements. So one of our major programs that provide long-term help in the community is our MiCHWA waiver program. This is a Medicaid-funded program designed to help individuals who are 65 and older or deemed disabled at a younger age to stay in their home as long as possible and avoid being in a nursing facility. So with this being Medicaid funded, the individual must have Medicaid or Medicaid with a spend down to be eligible. There is an income limit for this program, and that does change a little bit every year with the raise in Social Security. The individual applying also must be considered at a nursing home level of care. So the assessment that takes place for this program, the tool that's used is the same for nursing home facilities. So they have to meet eligibility requirements to be in long-term care, but the goal of this program is to stay in their home. They do have to have Medicaid, but this program can provide a variety of different services, from personal care assistance to light housekeeping and chores, meal delivery services, respite care to give caregivers a break. In some situations, it can even help in snow care and home modification. So it really just depends on the person and their needs. But this is an all-encompassing program to really help that senior stay in their home. Right now, we do not have a wait list for the MiCHWA waiver program. There usually is a bit of a wait as far as how far the opening assessment team is scheduled out to go see new clients, but there is no wait list for the waiver program at this time. So we do have individuals who may not be eligible for Medicaid or may not have Medicaid, may not be interested in applying. So for those individuals who still need in-home care, we do have a couple other service options. And one of those programs is called care management. For individuals 60 and older, there's no financial criteria. Really, we're looking at individuals who are also at risk of nursing home admission that want to stay in their home. And this program can provide assistance with things like personal care, homemaking assistance, medication reminders, light meal preparation. Now, the funding that we receive for our services is from the state, federal government, grants. Care management is a federally funded program and that federal funding stretches over several programs. So with that funding being limited, the services are also limited, but it can help with providing services for that senior to stay in the home. We also have a program called Targeted Case Management, and the goal of this program is to help seniors who may be eligible for the home health program through the Department of Health and Human Services to enrolling in that program by eliminating barriers to enrolling, helping them fill out the paperwork, finding a worker, navigating that process for a senior who may have difficulty with that. So we're looking at individuals who are 65 and older or 60 and older and disabled and with full Medicaid benefits. Unfortunately, we're not usually able to help with people who have a Medicaid spend down with this program, just because they usually have to meet that spend down to stay on the home health program. And for those of you who may not be aware, the Home Health Program is a state-funded program through Department of Health and Human Services that provides in-home care, or also known as chore provider services. So it is one of the other community-based options for seniors to get care in the home who do have Medicaid coverage. Another program we have that has no financial criteria is the Genesee County Senior Millage Program. So this is funded by the Genesee County millage dollars. The senior does have to be living in a Genesee County to qualify, and there is an age requirement of 60 or older. We're typically looking at seniors here who have a medical need for services to stay in their home. And this can include assistance with personal care, chore services, in-home respite, and adult daycare. So these services are also limited due to this being a grant-funded program, and the screenings and assessments are both conducted by Valley Area Agency on Aging. Now, the Genesee County Senior Millage Program and the Care Management Program do have wait lists for Genesee County, but we also serve Lapeer and Shiawassee County for the Care Management Program. Community Transition Services, this is a unique program that's designed to provide a transition navigator, one of the staff at our agency, to go into the nursing home and help a senior or an individual with disabilities to transition out of the nursing home, whether it's from a rehab side or long-term care placement, back to the community with supportive services. Now, this could include assistance with finding housing. This could include assistance with placement at an adult foster care home. This could also include providing in-home services for the senior so that once they are home, they have that care to help them remain in their home. This is a Medicaid-funded program, so we're looking at seniors who do have Medicaid for at least one day in the nursing facility. And we do need some time to work with the senior while they're, needing that assistance for the transition. So many times we need at least 4 weeks minimum or more to assist with that transition process. But this program can also help with assisting with getting medical equipment, eliminating barriers, like I mentioned, finding housing, and helping with home modifications if needed. We do have another long-term care program that's home delivered meals. So this is specifically focusing on getting nutritious meals to the homes of homebound seniors. There is an age requirement for this program. You do have to be 60 or older for this program. And the goal is to help seniors who are homebound, who cannot get out into the community regularly to obtain food, and seniors who are unable to prepare meals for themselves or have anyone living with them who's willing and able to prepare meals. So the Information and Assistance Department completes an interview to determine eligibility for this program. And if the person is found eligible, we do place their name on a wait list until availability for an assessment comes up. And then we do an in-home assessment for that program afterwards. There is no financial criteria for this program. Meals are typically delivered 5 days a week, and the meal contracted provider in Genesee County is G-Card. So G-Card delivers those meals. And we do have liquid nutrition available, which would be in the form of Ensure for those who need that added nutrition. Maybe they're malnourished or they're experiencing recent weight loss. So with the doctor's prescription, we can offer the Ensure as well. So moving on to a couple of our other unique programs, not necessarily targeted at long-term care, but targeted at helping seniors stay in their home, but also know that someone's out there caring for them, and maybe also combating isolation and loneliness that can sometimes happen with the senior population. So we do have 2 telephonic wellness programs. One is called KISS, which stands for Keeping Independent Seniors Safe. This is a telephonic wellness check available for seniors 60 and older who just want a phone call for someone to check on them every weekday. We also have chat. Chatting helps aging adults thrive. And this is a little bit longer of a phone call, more targeted at companionship, where KISS is a short phone call every day. This might be for an hour once a week, where this is providing companionship, someone to kind of talk with the senior about their interests, their hobbies, and just having a conversation. We do have a retired senior volunteer program for seniors who are interested in volunteer opportunities. We have a variety of partnerships for the volunteer opportunities. This is available for any senior in our service area 55 and older. And you'll see on some of these slides, I do have contact information for the specific staff person at VAAA you'd want to contact to get in touch regarding that program. But you can also contact our main number for any interest in any of these programs. We do have our Medicaid Medicare Assistance Program. This is a Medicaid Medicare counseling program available for seniors. We have a 1-800 number listed on this slide, how you could access this program, but essentially for any Medicare beneficiary who wants information on health insurance options like Medicare choices, Part D options for prescription coverage, interest on whether or not you may qualify for Medicaid. There are counselors cited at the local senior centers that can help you with answering those questions. In some situations, the counselors can also work with the senior over the phone. So this is really great information to know because open enrollment is really coming up quickly. And this is a service that seniors can take advantage of that would not cost anything to them. This program's not endorsed by any insurance companies. So the counselor is really just going to hone in on what options are best for the senior and their needs. So we also have a variety of wellness programs, exercise workshops, and caregiver classes in the community. So these classes are designed to help provide exercise opportunities as well as caregiver information to caregivers who are caring for someone with dementia or Alzheimer's. So we have a variety of classes. I have some information on Matter of Balance and the Diabetes Personal Action Towards Health listed here. The class schedules vary by season. Oftentimes this information is listed on our website. What I'm also going to do is post the most current class schedule in the chat so that you have that up-to-date information about fall classes. We also have a contact person, Abby Mars, who coordinates these programs that you can always call with any specific questions. But we also offer other exercise classes, including Silver Sneakers, the Arthritis Foundation Exercise Program. We do offer medical nutrition therapy, which is nutrition assessment and counseling from a registered dietitian. So I have Jeanette's contact information listed here about that program. We do have a partnership with Mott Community College regarding oral health cleanings for seniors 60 and older. Now, for that program, I'm also going to include a flyer in the chat about just for more information on how you can access that program if you're interested in a free oral health cleaning.
This is awesome. Brianna, I wonder if we could bring in the nurse T from the senior center. I'm seeing a few questions and allows them to get some questions about some of the resources you have. Just saw her. All right. Nurse T, what questions? My chat won't let me get to it. I don't wonder if Nurse T, you can tell us what questions they had. I just saw. Oh, we're still muted over there. Are these one of the questions I think I saw was, are these resources that people could get if they're residing not in a home, but in one of their a different facility?
As in like a senior community independent housing?
Yes, exactly
Yeah.
like that.
Definitely. So, we can certainly serve a senior who's living in an independent senior community. We do, in some situations, offer assistance if the senior is living at an assisted living or adult foster care home that we have a contract with, specifically regarding our waiver program. But generally, if they're living in a setting like that where they're getting 24-hour care, many of these programs may not apply. But certainly in the independent communities, or if they're living in a family member's home as opposed to their own home.
And then if someone from someone from the senior center, for example, wanted a reminder about some of these specific programs that they've heard about, what would be the best resource for them to access?
So our website has a lot of information about our programs and how to access our services. There's also a section of our website where you can send us a direct email message that a staff person will respond to. You can call us at our main number. We can always speak with you over the phone to give you an overview of our programs. We can mail a VAAA program brochure to you if you'd rather have that mailed out. So there's lots of different ways you can get this information. If you don't feel as comfortable accessing our website, I would say just give us a call at our main number and we'll get your information. We'll send you a brochure out to your home or just answer any questions you have over the phone.
Awesome. And then the last thing I'm going to do is I'm going to bring Javon, Gil, and Kent Key forward. As you all are thinking, Kent is going to talk to us a little bit about the family health history. And I wonder if either of them have thoughts on why these types of resources are so important, particularly for communities who might have been disadvantaged or marginalized, in terms of really knowing that they have access to potential resources. No, Brianna, don't go off camera yet. I want to keep you both here.
Okay.
Dr. Key, when we listen to all these resources and we think about some of your work and disparities and some of your really important work, and talk to us a little bit about why these types of resources are really important.
Well, these resources are important because it equips residents with opportunities to really have an equitable chance of having quality health. And not only just the health piece, but a lot of it is related to what I was seeing from the presentation is to those social determinants of health as well, right? So making sure that they're getting exercise, that they're eating healthy, all of these other components and factors that impact health. But it's very important that we incubate marginalized communities and populations with these types of resources in order to really offset some of the historical and compounding factors that have created health disparities in these communities for generations.
100%. Brianna, do you see that there's, obviously you're providing resources to communities. Do you feel like it's harder to get into some communities, or certain communities are without access to resources like the ones you're providing?
Yes, I would say that's certainly true. I think sometimes the public can sometimes be mistrusting. Sometimes people aren't always open to having us come out and to see them in their home, or even admitting to themselves that they do need that help. A lot of times we have callers in crisis, and we certainly want to do our best to help. But sometimes when it's in that imminent situation where, we only have so much wiggle room because we don't provide emergency services. So really, we try to get the information out there as best we can and promote our services so people are aware, so that they know how to access our programs ahead of time.
Awesome. And then really quick, I have a question for Dr. Gill, who we have not introduced, but is a family medicine resident who sees patients in his office all the time. And I wonder if you would just give us some context for the patients that you're seeing in your office and the types of services that Brianna has talked about, and how much the people that you're seeing need access to these resources.
Thank you for having me on today. Everything that's been mentioned so far that I've heard of have been really important resources for a lot of my patients. I work with patients of all ages, and a big portion of those patients happen to be elderly patients in the city of Flint. I happen to work in the city of Flint, so I see a lot of people who are disadvantaged that have these social determinants of health. And fortunately, at the practice I work at, they do social determinant of health screenings for every patient that comes in, so we can see what resources they need. I got to admit that some of these resources are things I wasn't even aware of. So I had to take notes on some of these to make sure that they're available to my patients. And I think that as providers, the burden isn't just on the community, it's not just on the patient, but it's also on the providers like myself to make sure that I'm aware of these resources, because there's been more than one thing that's mentioned that I'm like, oh, I can think of a handful of people that this applies to. So I'll be trying to reach out to make some connections with you guys to get some more information on that for sure.
Hey, thank you so much. Thank you so much, Brianna, for all of these wonderful resources. Can you throw those links in the chat as well as your contact information before I pivot to talked a little bit about family health histories? Brianna, thank you again.
Thank you so much for having me. Thank you.
Dr. Key already told me that he's an only child and I should not cut into the amount of time he has. So I'm sorry.
I did not say that. I did say I was the only child, but that was a whole different conversation, Jen.
I love to hang out with Dr. Key. He is such a wealth of information and one of my favorite people. So shout out to you. Thank you so much. And you have, I've taken away a little bit of your time. So you got about 10 minutes, but okay. I appreciate you.
I'll give you a couple of minutes back. Not a problem.
Oh, love you back.
Thank you so much. So, the particular project that I'm going to talk about is one of the studies that I'm funded for, looking at family health histories, but this is really connected to some of the other work that I do with the Michigan Center for Urban Aging African Americans in Research. We call that MiCHWA, which is a conglomerate with Wayne State, Michigan State, and the University of Michigan. And through that, we have the Healthy Black Elders Flint group that does a lot of work with engaging our elders and our seniors into health and also into clinical trials and different studies that could help not only address some of the health issues, but it also helps with the underrepresentation of African Americans in clinical trials. And that's something that we see across health indicators, whether it's cancer or stroke or diabetes, etc. So we want to talk about achieving health equity, effective community engagement to advance the creation of an African American family health history tool. Next slide, please. And so no conflicts of interest for this presentation. Next slide. This particular study is supported by the National Institutes of Minority Health and Health Disparities from NIH under the KO1 mechanism. Next slide. So real briefly, we're going to kind of discuss the importance and relevance of family health histories as it relates to African American health, discuss the role of community-based participatory research known as CBPR and community engaged research and the role that they play in advancing health equity, and then demonstrate kind of the use of social networks and social capital as a foundation for engaging African Americans for research into things like family health history studies and to address for those appropriate cultural competence. Next slide. Real quick, I'm from Flint, born and raised in Flint. I'm a Hurley baby, went to Northwestern High School. You should have been a Wildcat. That's all you need to know about me. Next slide. So here's the team for my study. We have the late Dr. Ehil Deloney, who was one of the community mentors, Reverend Dr. Sarah Bailey, Dr. Patel from the University of Michigan, Dr. Sikorsky, and Dr. Lucas, both from MSU, Dr. Tabia Akintobi from Morehouse School of Medicine, and then Dr. Jennifer Johnson from Michigan State University College of Human Medicine, and then my research assistant, which is Corinne Blanchard. Next slide. So the thing that we need to understand is that African Americans, and of course, we don't need one more study to be funded for us to know this, that African Americans are disproportionately impacted across health indicators as it relates to health disparities. So whether we're looking at diabetes, whether we're looking at stroke, Whether we're looking at cancer, I think we always talk about breast cancer as a very clear example, how there are more European American women that get breast cancer, but more African American women die from breast cancer. These are disparities, these are differences, these are gaps that we can see across ethnicity and race. And we really want to think about, why does this happen? Why does it happen in blood pressure? Why does it happen in HIV and STDs? Why does it happen in cardiovascular disease, etc.? And we have to think about what we know from the data, and that is that African Americans are not necessarily getting the preventative screenings that they need in order to catch things early. So what happens is they normally catch things late, stage 4 of cancer, late in the progression, and oftentimes it then impacts their morbidity and their mortality rates. So we need to have preventative measures in place, like proactive actions such as screenings, and other preventative actions in place. Some of the factors that contribute to health disparities in the African American community is also the lack of general health literacy. Literacy level in the United States in general is about 4th to 5th grade on average. And so if you're talking about health and medical terminology, it's even worse. You have people with degrees, with master's level degrees and PhDs. When it comes to medical and health terminology, their health literacy is not really up to par. And so we know that health literacy is an issue that we have to address. And then racially inappropriate health communication strategies, right? We have to make sure that the type of health communication strategies that are going into marginalized minority communities, that they are culturally appropriate and that they are culturally competent. So the reason why family health history tools are so important is because it is a preventative mechanism. If you know and you are armed with the information of what runs in your family, then you can then better inform your doctor, you can better inform your other family members, and you can better inform generations behind you so that they can have the type of preventative precautions that are needed that may prevent the onset and early onset of disease. And so family health histories, and I try to share with people, it's more than just the tool when you're filling out that form on the clipboard. Family health history, that's part of it, but it's the knowledge. It's knowing what runs in the family. It's knowing these things, and then how you effectively communicate those things to your provider, your healthcare provider, and also to your family. And so you have to have that mixture of health communication, health literacy, and then creating and having an understanding of what your actual family health history is in order for you to be effective. But what we also know in the literature is that African Americans grossly underutilize. It is so underutilized in the African American community because culturally, and this comes from days of slavery, you just don't talk about certain things, right? On the plantation, if something happened to you or someone abused you, you couldn't say anything because it could cost your life or life of your loved ones. And we have internalized that culturally and as a survival mechanism and have passed it down from generations. So it's not just about, snitches get stitches and you don't talk to the police. That culture of silence has been passed down from generation to generation in different domains of our life and of our existence. You have family members. I remember being probably about 7, and I heard a aunt telling her kids she was going into the hospital for a procedure and don't tell nobody my business, right? So we have this thing about keeping things silent, and it's that silence that's killing us. I had a friend who had a full hysterectomy at 24 years old, but did not know that her grandmother had a partial and two aunts had a hysterectomy because they didn't talk about it. So she wasn't prepared. She didn't know that information. And maybe if she had been armed with that information at 17 and 16 and 19 years old, and as she was sharing that with her doctor, maybe some things could have been put in place for her. So it's the lack of information, and it's that culture of silence that is causing African Americans to underutilize family health histories. Some of the challenges, however, is that most of the general family health history tools, there are tools on national government websites on how to do a family tree and log your, family health history in. But most of those existing tools are very general. And when you think about African Americans, who, one, it's hard to get African Americans to get into research, and two, to go to the doctor, and it's more than Tuskegee. People always point to Tuskegee. There are hundreds of studies and engagement with the medical industry that have misused unethically people of color and women. And so we have to think about the historical mistrust, right? So we have to make sure that we have some tools that address those historical barriers, but that also are appropriate culturally, have the different type of appropriate language, right? Address health literacy levels. I have an uncle to this day, he will not say he had diabetes. He'll still say he has sugar, right? And so what does that mean? How does that translate in communities? And so we have to make sure we have the proper language and the proper terminologies so that we can have effective communication. And then we have to actually have culturally relevant family health history tools so that we can ensure that we have not only something that's appealing and that's addressing the historical misuse, but something that people will use. Next slide real quick. I'm going to go through really quickly. And so this particular study, we have 5 phases of this study. We are now starting to recruit for phase 5, which is the randomized controlled trial. The conceptual framework is that if we were to increase interest in an African-American specific family literacy and health communication, we should see an increase in health screenings and preventative behaviors. And we can stop right there. That's the overview. If anyone is interested, let us know, but we are definitely start to recruit for our randomized controlled trial to test out this toolkit. And by the way, this toolkit was built by local Flint residents. In phase 1, we have focus groups with local Flint residents about it. In phase 2, we had workshops. They created their own culturally relevant toolkit for family health histories, and then we tested it out in our pilot. So we're looking forward to the randomized controlled trial.
Shout out to you, Dr. Key.
Go ahead,
Super
Dr.
appreciate you. You are the best. This is really, really important information, and we experience it and I'm sure I just saw Dr. Gill would agree. These are things that we're hoping you're bringing to your encounter. So thank you so much for this really important information, Dr. Keith.
Thank you.
Awesome. Last person who is probably going to scream at me because I've given her 2 or 3 minutes, but you can take what you need. It's really important that we think about this community health needs assessment and fall programs update. Nicole, I love you. Please don't hold it against me.
No, I can make this work. So we're going to actually go ahead and move to the next slide. This one. Okay, so we are in the starting point of our next iteration of the Community Health Needs Assessment. So this is a beautiful informational booklet that we put together every 3 years alongside the local health systems as well as the Genesee County Health Department. And one of the most critical items of this Community Health Needs Assessment obviously is community resident feedback, right? So we have released our community resident survey and we are encouraging all folks to complete it. We have a digital version, we have print versions, we have a Spanish version, we have an Arabic version, and we're really just helping and looking for folks to help distribute this survey. So if your organization is interested, we are happy to drop off paper copies to you. Any way we can support the completion of the survey, that's really what we're trying to do here. We expect to have the survey be open probably through the end of November. And then what that will lead to is we will create ideally a beautiful booklet in 2025 that really summarizes all the data that we're able to collect, and then also all the feedback from our residents. So we definitely encourage your participation in that respect. And I think the other items, I actually want to come back next month and talk about, if that's okay with everyone, because
I love it. Please.
Okay, perfect. So TBD, we have a lot of cool health and wellness programs that we are excited to share. So I will come back next month and talk about those items.
So not only are you under time, but you've agreed to come back next month. So I win. I really appreciate you, Nicole. Thank you so much to all of our wonderful panelists. You gave a wealth of information and you even dealt with me like jumping in the middle to keep us on time. So I super appreciate you. Shout out to Nurse T and Dr. G who are at the Senior Center. One last shout out, Dr. G or Nurse T, do you want to shout out your seniors before we leave? They're all busy. All right. If they can't jump on, that's okay. Let's see. We'll give them a couple seconds. Well, anyway, shout out to Nurse T and Dr. G for always being in the community and always making sure we get some community questions answered. We will see you next month. Thanks again for tuning in.
Thank you.